really depends on how you define success. Therapy can help a person solve significant issues in their life, can greatly reduce and even eliminate symptoms of depression and anxiety, can improve relationships, social skills, and even work performance and motivation. But it is not a magic wand, unfortunately, and therapy only works as well as the factors involved, such as a client's motivation, dedication, and openness. It also depends on the therapist's experience and level of skill. If those factors work in concert with one another, the sky's really the limit. My therapeutic style is quite active. Some people will ask, well, what's your theoretical orientation? Are you psychodynamic? Are you cognitive behavioral? Are you humanistic? And my response is, I'm effective. Period. I'm not one to simply sit there and nod and be quiet or just reply with mm-hmm or tell me more. I believe in being an active, involved partner in solving problems. To this end, I believe in giving direct, honest feedback and practical suggestions. In my experience, the best therapy involves genuine interaction, which includes space for expressing yourself, receiving support, confronting different, and difficult subjects, and even using humor. My primary goal is to offer suggestions, help you explore viable options, and point out opportunities to try out new behaviors or responses. The goal of which is to effectively learn from your past, prepare for your future, and be mindful of your present. The professional you choose very much depends on your treatment needs and the level of training that you desire of your professional. Psychiatrists, for example, are physicians who specialize in the prescription of psychotropic medications for the treatment of more, shall we say, severe mental illness, such as bipolar disorder or schizophrenia or advanced forms of depression. Most psychiatrists do not have extensive training in talk therapy and use medications as the primary source of their treatment approach. Do not be confused by the term psychotherapist. That does not mean a professional is a psychologist. An important fact to remember is this: all psychologists can be considered psychotherapists, but not all psychotherapists qualify as psychologists. In order to be qualified as a psychologist, one must have earned their doctorate in psychology and successfully pass a national and statewide licensing examination. While the master's level counselor has 2 years of graduate training, the psychologist must complete a total of no less than 5 to 7 years of advanced graduate school. Psychologists are not only well trained in the basic elements of stress and conflict, they are also considered experts in the more vast spectrum of psychological ailments, from the more common adjustment issues to the more severe psychotic and pathological diseases. Psychologists do not prescribe medications, although they may make the recommendation for adjunctive psychopharmacology. I was one of the first psychologists to pioneer the process of offering video conferencing to my private practice clients. While this method of communicating is not necessarily superior to the more typical face-to-face office appointments, it does offer a myriad of benefits and opportunities not previously available in treatment. Because of the ability to log on anywhere, appointments can be offered with greater availability, such as early mornings, midday, or even late evenings or weekends. There are no limits. Also, for those with younger children or hectic schedules where it's difficult to leave home or the office, the freedom to sign on to your computer brings a therapeutic experience to you. Let's not forget the advantage of saving on gas, parking fees, or the potential inconvenience of commuting. Typically, web-based video sessions are available only after an in-person consultation has occurred. While the webcam is a great tool and invention, we must remember that relationships of any kind are best started in person, and therapeutic relationships are no exception.